We'll resume once more, and at question number 2, I call Anas Sarwar.
Thank you, Presiding Officer. Can I start by echoing the comments about Nick Sheridan? He was a young, talented and charismatic journalist with a huge future ahead of him, and our thoughts are with his family, friends and all his colleagues at the BBC. Presiding Officer, when we're discussing issues of life and death in our NHS, I think, frankly, patients across Scotland deserve better than what they've seen in the last 20 minutes here at First Minister's Questions. The treatment time guarantee is a legally binding maximum waiting time of 12 weeks from referral to treatment. How many times have the SNP government broken this law?
First Minister.
Presiding Officer, well, I don't have that figure to hand. There's no doubt, of course, that we have seen increases in waits and long waits due again to the global pandemic. We know there was challenges before the global pandemic, and that's fair to reference, but we're also making progress in terms of those long waits. But we are investing in a recovery, and that's why we've seen, for example, operations that were performed in January of this year increasing by 15% in comparison to the month before. But these are challenges that are faced right across the UK. If I look at the data for the 31st of December 2023, it shows that in Scotland there were 124 patients per 1,000 of the population for treatment time guarantee that were waiting, and new outpatient appointments as well. This is fewer in England, where 134 patients per 1,000 are on the RTT, referral to treatment waiting list, and in Wales, where the figure is 244 per 1,000. So that is cold comfort, of course, to those that are waiting in Scotland. But the point being, of course, these are issues that are impacting our health service right across the UK. So I go back to the point I was making to Douglas Ross, to Anas Sarwar. We are investing in that recovery and beginning to see progress in relation to the reduction of those who are waiting the longest, and indeed in terms of activity in the NHS going up. So this government will continue to invest in our NHS with record funding of over £19.5 billion.
Anas Sarwar.
Presiding Officer, it is written in law that a patient should be treated within 12 weeks. The SNP have broken this law over 680,000 times. And Humza Yousaf might try and blame the pandemic, but this law was broken over 320,000 times before COVID. Shona Robeson broke the law 158,000 times. Michael Matheson broke the law 184,000 times. And Humza Yousaf broke the law 235,000 times. And since he published his so-called NHS recovery plan, the SNP have broken the law 306,735 times. Every one of these breaches is someone waiting anxiously for a medical procedure, often in pain. Many have put their lives on hold, stopped work or retired because of their condition, and too many of them have been forced to go private in the middle of a cost of living crisis just to stop the pain. So, First Minister, will you apologise to the 680,000 people your government has failed by breaking this law?
First Minister.
Presiding Officer, I already said in response to Douglas Ross, of course this government apologises and regrets anybody having to wait longer, whether it's for unscheduled care, whether it's for long waits, whether it's treatment time guarantees. We, of course, don't want a single person waiting longer, a day longer, a minute longer than they have to do. But what Anas Sarwar does is completely ignores the impact of the pandemic. He does this every time he talks about the health service. The pandemic, of course, was the biggest shock our NHS has faced in its 75-year existence. There was, of course, progress being made in relation to waiting times before the pandemic, but, of course, there's no doubt that the impact of the global pandemic has been severe on our health service. I go back to the point that we are beginning to see some improvements. We're beginning to see activity increase when it comes to, for example, those who've waited the longest, those 2-year waits. For outpatients, we've seen a reduction of new outpatient appointments, a reduction by 66% from the end of June 2022, and for those inpatients or day case treatments, reduced by around about a quarter. And what are we doing about that? We're ensuring an increased capacity for 20,000 additional surgeries. We've also provided 7 mobile MRI and 3 mobile CT scanners to increase
First Minister.
additional activity. And we're also supporting mobile operating theatres right up and down the country. But I go back to the point I made to Douglas Ross, to Anas Sarwar, that we're doing all of this in the face of 14 years of UK Tory austerity and a real terms cut to our budget. Much better for us that we had control over our own finances, so we wouldn't be at the behest of cruel Westminster governments who continue to cut our budget, Presiding Officer.
Anas Sarwar.
Presiding Officer, 17 years in government, and that's the best answer they've got, seriously. Because across nearly every measure, this government has failed. They have broken the treatment time guarantee law 680,000 times, 320,000 times before the pandemic. Now, Humza Yousaf wants to pretend that things are getting better. But let's look at the NHS stats published just this week. A third of patients not being seen within 4 hours in our A&Es. Over 8,500 people waiting more than 12 hours in 1 month. 55,000 fewer planned operations in the past year compared to before the pandemic. 5,500 children waiting to receive mental health treatment. And 1 in 5 people getting crucial bowel cancer tests. Only 1 in 5 people getting crucial bowel cancer tests on time. Shocking, when cancer remains Scotland's biggest killer. So, First Minister, do you accept that waiting time standards exist for a reason? That every time they are missed, it puts lives at risk? And that your government's incompetence is destroying the NHS and failing staff and patients?
First Minister.
It is, of course.
We will suspend once more. I call upon the First Minister to respond.
Presiding Officer, let me go back to, of course, the fact of the matter that the global pandemic has undoubtedly caused real challenges for health services right across the UK, including in Labour-run Wales and Conservative-run England, and, of course, where we are in charge here of the NHS in Scotland. But statistics this week have also, of course, shown the outcome of that record investment that we made in the NHS, i.e. headcount in the NHS is at record high levels. And also, of course, that we have made improvements in CAMS as well. That was referenced by Anas Sarwar. Still improvements to be made, still work to be done. But we continue to see sustained improvements in CAMS weights. National performance against the 18-week CAMS standard, the 4th highest since records began, the highest achieved since quarter ending March 2016. We've also seen increases in CAMS staffing as well. But I end on the point that I made to Anas Sarwar and indeed to Douglas Ross a moment ago. We know that the NHS is struggling as a result of the global pandemic. That's why we're investing over £19.5 billion in the most precious institution, our National Health Service. But we're doing that in the face of a real terms cut over the last couple of years from the Conservative government. What makes that even more difficult, of course, is that when Labour's General Election Coordinator is asked if he disagrees with a single Conservative budget proposal, he says no. They have the same spending plans as the Conservatives. So whether it's Labour austerity or Conservative austerity, Presiding Officer, Westminster austerity is going to continue to undoubtedly impact and damage our public services. And in the face of that, this government makes no apologies for record investment in our NHS.